Hello, ladies and gentlemen, again, it's me again making a video once again, Steven. It's about medical, again, naturally, you know that. Just wanted to do a little bit about, um, this is sedative, okay? Um, Basically, a lot of people take different sedatives for different reasons, okay? Some people are happy with their ativan, okay? Some people are happy with Klonopin, which are restless leg syndrome, and a lot of other things too. Seizures, even too, to tell you the truth. Um, Anxiety, it works for it too. Okay, it's a benzodiazepine that lasts longer than Xanax. Okay, and they have the alprolizum, which is Xanax. Okay, then they have Xanax, it's not generic. It's name brand, okay, which works really well. Okay, for me, I believe so because I've been taking it for a while, and that's just me. Okay, it works just for me. Okay, I should know because I've taken Zoloft. Listen, I'll tell you a story about Zoloft. It's very terrible. Yeah, I took a Zoloft before people, ladies and gentlemen, out there, kids, and I mean everybody. Um, I don't recommend it. Your doctor might recommend you to try Zoloft, okay, your first round or your second round of seeing a doctor or a psychiatrist or whatever you're seeing. Quack. I'm kidding. I'm joking. But anyway, some are quacks. But I don't like judging, but still, truthfully, you want to get to the bottom of your panic attacks, right, guys? How many people want to get to the bottom of their panic attacks? Everybody. Nobody likes panic attacks. Nobody likes, you know, feel like they're dizzy, they're off balance, and they're gonna pass out, like like a drunk, like I don't know, it's hard to explain. Um, Dizzy spells. Okay, there's the answer. Okay, now it's like a train wreck. A train's gonna, something's going sideways or something like that. Sideways, yeah, crooked. Okay, so okay, what might work for you, ladies and gentlemen, don't get me wrong. What might work for you may not work for Stephen. Okay, but I do have good experience taking Ativan. Ativan works pretty good. Okay, but I said but not as well as Xanax. Xanax, I know they always say it's a nasty old word. I know what people are thinking about that, okay? But if it works for me, why can't I take it? Right? Okay, for Christ's sakes, I could tell you something to raise your hair up to 100 feet right now. You ready for this? You ready to light a match? Okay, listen to this. Okay, don't light a match. I'm just joking. Okay, Zoloft has been proven to cause suicide rates to emerge, gone up. Okay, Paxil has caused suicide rates to go through the roof. Okay, it's got your brain waves and everything else fixed. Oops, got a little thing on the screen there for a little bit. Okay, Prozac has skyrocketed suicidal rates. Pamela has caused suicidal rates to go through the roof. Okay? So my question to you folks out there, we're running out of drugs. We're running out of time. We're running out of the answer. We're running out of clues. Okay? We don't got much time to think, do we? I mean, this patient over here is suffering. Let's say we got a patient over here suffering in a hospital right now. What do you want to give him to make him comfortable? He's he's having emotional fits. What's the best thing to give him to settle him down? Think. Valium. Okay? That puts him to sleep. Okay? It makes him rest and sleep it off until you can think about what you're going to give him to make the mood a lot better. And so you can come up with a concoction of serotonin levels to where they're not all whacked out. Okay, I'm not saying you're taking acid, nothing like that. I'm just saying so you can get the right level of dopamine. Okay, yeah, that's part of it. Dopamine and levodopa and serotonin levels, norepinephrine, all those chemicals in the brain, you have to have level. Without that, it's not going to be normal, guys. It's going to be misfiring, okay? Just like let's say your lights in your truck are flickering, okay? And you're having a misfire, okay? Something in the brain is misfiring, okay? You need to fix it, okay? How are you going to fix it? Neurotransmitters, and you get little neurotransmitters in there. Last time I said it wrong. GABA, okay? That's what you're hitting, the neurotransmitters. There's calcium channel blockers, two of also you want to hit, too, also. Speaking of that, I gotta take that. Okay. You want to make the patient, number one, role, being a doctor, or treating a patient, not even just being a doctor, treating a patient is to make the patient comfortable. Okay? That's what I'm saying. You want to make the patient as comfortable as possible. You don't want to tell the patient, oh, you're going to die. Do you? No. Absolutely not. It's uncalled for, ladies and gentlemen. You want to have some confidence in yourself. I can do this. I can pull this off. I can find a concoction. I can find something. Maybe I can give him a little bit of Klonopin, last a little bit longer than Xanax, and then I can give him a little bit of Seroquel at night. You ever think about that? It might work, right? Try it for a while. If it doesn't work, try something else. Variations. Trazodone, is another good one, which is Desiril, generic, Zol, Trazodone. Yeah, it goes in the Desiril, okay? So there's a lot of different ones you can try. I'm not talking about sleep aids. I'm talking about antipsychotic medications here we're talking about. And I'm talking about Zoloft. It's the last resort I would want to fire upon use, okay? That's the last one I would want to use because there's 1,000 different side effects or more to Zoloft itself, okay? It's caused suicide in a lot of patients, okay? You may not believe me. Even Dr. Mind himself doesn't like using Zoloft anymore after what a woman told him, okay? Some woman came up to him and said, my son is going suicidal now. It's all your fault because you gave him Zoloft. And sure enough, he almost died. Bingo. What's your answer right there, doctor? Answer that question. How can you fix the situation? You're the doctor. Fix the situation. Get on it. Get right on it. I believe we are getting to be educated fools. We're getting ahead of ourselves here, guys. We are not really treating what we need to be treating. We gotta treat the problem itself and stop treating what we think is wrong, okay? We don't treat what we think is wrong. We treat what is wrong with the patient. If you give them ativan drip, get a valium, whatever, to calm them down, give them valium. Calm their butts down. You might think they're a drug addict just because they walk into your hospital and they get a little bit of valium or whatever, and and they come back and you get, that might be what works for them. Just because they come and have Valium doesn't mean they're a drug addict, ladies and gentlemen. You know what? Over half the people that you give the drug to are no more than a drug addict than the ones that started the abuse, okay? That you got hooked on drugs in the first place, okay? You, the doctor, if that was really true that they're drug addicts because of a drug, you gave them. I guess it's your fault, then, doctor. Right? Then I guess you're the drug dealer. You're the one that caused all the problems. You're not fixing the problem, are you? You're causing two problems: addiction, and what else you causing? You're not fixing the problem. But actually, you are fixing the problem because it does calm them down. That's one problem you have fixed. That second problem you can deal with later. Okay? Now, you want to get the patient under control, just like in haloperidol, Haldol. Okay, they give it to psychotic patients too. Haldol is the same damn thing. Halcium, I know a lot of psychiatrists do not shy away from Haldol. I mean, not Haldol, Halcium. Okay? Haldol. Got mixed up there for a second. Because they don't like to mess around with the Ambien, they don't like to mess around with the Halcium, they don't like to mess with all this other stuff. It's a bag of tricks, you know. Because, you know, you jump curbs and you can drive drunk and you can get a sandwich in the dark and you wouldn't even know it. I mean, the crazy things that they come up with nowadays. Okay, see, the doctor doesn't know all about the human brain yet. So that's part of the problem too. I don't think they'll ever know about the human brain. I mean, they're not neurologists. Neurologists don't even know about all of the human brain yet. They gotta experiment to learn. They gotta practice to learn. Practice makes perfect. There's a lot of secret programs going on right now, and New Mexico was one of them. Okay, got caught. They got busted. Okay, think money comes to the patients, all because they use their organs without a signature. And I know one of them. Okay, that's all I'm going to say. Okay, I'm going to go and close for right now. Have a good day. Take care. God bless. Take care. God bless. Facebook, and have fun and enjoy. Take care. Hello, ladies and gentlemen, again, it's me again making a video once again. Stephen. About medical, again, naturally. You know that. Just wanted to do a little bit about, this is sedative, okay? Basically, yeah, I took a Zoloft before people, ladies and gentlemen, out there, kids, and I mean everybody. I don't recommend it. Your doctor might recommend you to try Zoloft, okay? Your first round or your second round of seeing a doctor, okay, which works really well. Okay, for me, I believe so, because I've been taking it for a while, and that's just me. Okay, it works just for me. Okay, I should know because I've taken Zoloft. Listen, I'll tell you a story about Zoloft. It's very terrible. Anxiety, it works for it too. Okay, it's a benzodiazepine. It lasts longer than Xanax. Okay, and they have the alprazolam, which is Xanax. Okay, then they have Xanax. It's not generic. It's name brand. A lot of people take different sedatives for different reasons. Okay. Some people are happy with their ativan. Okay. Some people are happy with Klonopin, which are restless leg syndrome, and a lot of other things too. Seizures, even too, to tell you the truth.